Hi guys, hello to today's episode of Feature of the Day. Topic for the day today on 4th of April is World Vitamin C Day. So today we would like to talk about something regarding vitamin C, that is ascorbic acid, and its outcomes on pregnancy. So often when people are asked regarding what are the fruits or what are the dietary habits that should be inculcated to get adequate amount of vitamin C. And a lot of people cannot go or cannot think beyond citrus foods. And by citrus, I mean it can be lemon, it can be oranges, it can be sweet lime. But if I am to tell you that these aren't even the major sources of vitamin C and there are more, then you could definitely advise these to your patients, especially the pregnant women. So, what are the other sources? As you can see in the picture over here, I have given a few sources, but even two better sources that exist today in the market and are available for everyone, irrespective of their food habits, are the Indian gooseberry, that is the amla, and a guava. So, apart from these, tomato and the usual suspects being the oranges, sweet lime, and lemon, and also tomato are great sources of vitamin C. But vitamin C, why do I need to be having a day to talk about something that is so unanimous with our diet? And we've often read during our biochemistry lectures that the deficiency of vitamin C can cause scurvy. But how many of us have actually seen the deficiency of vitamin C manifest? It is that rare. But there are finer aspects to vitamin C and pregnancy that link them intricately. And what are they? So, first of all, iron absorption, as we have read, is increased by a few substances and decreased by a few. So the ones that decrease include calcium and phytates and tannins. Tannins is something that is contained in coffee and tea. Whereas calcium, I mean, that is one of the reasons a lot of people fail to understand that whenever you prescribe calcium supplements with iron, you shouldn't be giving them during the same time. For example, if you're giving iron supplementation in the morning and in the evening, then your calcium has to be given only in the afternoon. Otherwise, they tend to impair the absorption of iron. Plus, both these substances are known to cause gastric mucosa irritation. So, this can increase the chances of nausea and patient not adhering to the treatment, thereby leading to iron deficiency anemia. But the point to be noted here is vitamin C and iron. Now, we have read in physiology that the iron that we consume, and most often the non-heme iron that we consume, is in the form of ferric or Fe plus 3. So, whenever I'm giving Fe plus 3 in the form of Fe plus 3, I need to understand that this is not going to be the source of absorption. This is not going to be how my ferrous, that my iron is going to be absorbed. So, what I need to do is my body needs to convert this ferric into the ferrous soluble form. Now, as you all might remember, that iron is not absorbed from the stomach, it is absorbed from the duodenum, and duodenum contains all the alkaline juices. It contains an alkaline environment, and alkaline environment can impair the absorption of ferric. So, it requires the presence of ferrous form to get absorbed from the duodenum, and this is ensured first of all by chelation using vitamin C or ascorbic acid. The ascorbate forms it forms a chelation with iron, which helps in its absorption and protects it from the alkaline medium. Also, iron serves to donate an electron and reduce ferric from Fe3 plus to Fe2 plus, and that aids the absorption of iron. Eventually, this increases the absorption of iron and helps us reduce the prevalence of iron deficiency anemia. Often, a lot of drugs that you might get in the market, the iron supplements, often they contain vitamin C in themselves, so you don't need to give vitamin C directly or separately. I am going to address at the end of this lecture on what is the ideal dose to be given of vitamin C in pregnancy and in breastfeeding. It differs a bit. The next the next significance of vitamin C in pregnancy includes it is an antioxidant. We have often read that three major antioxidants include vitamin A, C, and E, ACE. So, of them, vitamin C is a major antioxidant. And by antioxidant, in other words, I can say it reduces the oxidative stress. Oxidative stress is something that causes damage to the body by the release of free radicals. Free radicals are basically they are basically particles which contain an extra electron. So this gives, or rather, this gives a hydrogen to it and reduces these free radicals, and this helps in protecting our body from oxidative stress. Now, few of the problems that oxidative stress can create in our body include preeclampsia and fetal growth restriction. So these are known to be events that are caused by free radical injuries. So the incidence of this can be reduced by that. Also, I need to know that if we are going to talk about the amniotic membranes, so amniotic membranes are tense. You often require a very sharp instrument to do amniotic fluid or rather amniotic membrane rupture. So rupturing the membranes often requires a cockers or a needle. So this tensile strength to the amniotic membrane is given by the collagen cross-linking that is present in the amniotic membrane. Now, this collagen cross-linking is mainly by collagen 3 rather than collagen 1, but basically it often depends also on the presence of vitamin C, which forms a cofactor in maintaining this tensile strength. So obviously, in patients in whom there is a deficiency of vitamin C, these women are going to be at a higher predisposition to developing premature rupture of membranes as well as preterm premature rupture of membranes. And this eventually increases the chances of induction of labor, cesarean section, and if it is PPRM, then it leads to increasing chances of fetal distress after delivery. So this is a very significant point that has to be noted here. Secondly, something that is very rare, infantile scurvy hardly ever seen, given that almost all our diet nowadays contains vitamin C in adequate concentrations, so not significant anymore. Lastly, it also increases the birth weight by causing mild placentomegaly. It basically improves the endothelial function. Now, you might have read that vitamin C also has a very crucial function in maintaining a good endothelium, which is also why it reduces the incidence of heart disease, coronary artery disease. Similarly, in pregnancy, it increases the uteroplacental flow of blood, which is why there is going to be a slight increase in the birth weight towards a more positive side, not towards the macrosomia side, but towards a better side of it. Finally, in wound healing, again, it has a great deal of impact on the epithelium and it increases the wound healing and any wound in the body. So, in patients who have had a cesarean section, their skin wound healing will improve when you provide them with adequate amounts of vitamin C. And the chances of surgical site infection also and malapproximation, disapproximation also decrease significantly. Now, finally, coming to the topic of what is the ideal RDA, recommended daily allowance of vitamin C. During pregnancy, you have to be giving 85 milligram per day of ascorbic acid or vitamin C, whereas during breastfeeding, it has to be 120 milligram. This is provided roughly when you give a patient 1000 milligram tablets of vitamin C per day. This also accounts for all the loss that happens. So basically, it has around one tenth bioavailability. So 1000 milligram per day. We get tablets of 500 mg in the market. So giving two such tablets along with iron supplementation is adequate to ensure that the patient not only avoids vitamin C deficiency but also helps in the increase in absorption of iron and reducing the other complications. Thank you.